Shin splints are no joke. And though there are definitely worse running-related injuries, it's hard to look on the bright side when your shins feel like they're going to fall off with every step. Fortunately, there's a lot you can do to prevent shin splints from happening in the first place. And if you're already dealing with them, there's plenty you can do to speed up the healing process too. Let's start with the basics, and then I'll walk you through the best ways to treat shin splints and prevent them from ever happening again. What are shin splints? Shin splints gradually form in the lower legs when your muscles and bones strain after being pulled towards your shin bone, or the tibia. Eventually, due to the contact between your bone and your muscles, your leg becomes so irritated and swollen that you develop a painful inflammation. Usually, athletes and especially runners who put repeated stress on their shin bones, muscles, and connective tissues run the risk of forming shin splints, or even the more technical and accurate name of medial tibial stress syndrome. No matter how you pronounce it or what you call it, it's still pretty painful. And if left untreated, a shin splint could potentially form into a tibial stress fracture. Shin splint symptoms. So how do you know if you're suffering from a shin splint? The most prominent symptom is stinging pain in and around your shin, which can range anywhere from mild to severe. Usually, you'll feel a gradual leg pain develop while walking, running, or jumping, with the height of the pain occurring toward the end of your physical activity. If you're experiencing some of the following symptoms, chances are you have shin splints. A slight ache or a sharp, throbbing pain in front of your lower leg around your shin. Pain or discomfort on the left or right side of your shin bone. Muscle pain radiating from the shin up toward your knees. Painful discomfort running along the inner part of your lower leg. Soreness or tenderness around the inner part of your lower leg. Tenderness of your shin bone. The shin is warm or hot to the touch. Visible, usually mild, swelling in your lower leg. Dull numbness or weakness in your feet. What causes shin splints? Shin splints can wreak havoc on just about anyone. At the core of tibial pain, though, is frequent repetitive pressure on the shin bone. Here are a few other factors that can cause the painful formation of shin splints. People with flat feet are more susceptible to shin splints because of overpronation, when the arches of their feet collapse upon contact with a surface. Individuals who exercise without stretching during their warm-ups or cooldowns do not give their muscles and ligaments sufficient preparation to deal with repeated motions. This is also true for those who start new exercises or routines too quickly and/or accelerate their activity much too quickly. People with weaker ankles, hips, and core muscles will force extra pressure on their leg muscles when they make contact with the ground, which can radiate up towards the shins. Individuals who wear shoes that don't fit properly or lack sufficient support are at a higher risk of shin splints as well because their feet cannot appropriately absorb the shock from running. How do you treat shin splints? If you want to speed up the recovery process, follow these 5 helpful tips. Number 1. Get some rest. In this particular situation, no pain, no gain is only going to make matters much worse. What you should be doing right now is getting some much needed rest so that your body can properly heal. So take it easy right now, but not too easy. Don't take a period of total rest. Your goal, after all, is to offload your injured area, but that doesn't mean you have to stop building your strength, as that can help with facilitating the repair process. Of course, if you've noticed pain in your calves or shins from a specific activity, discontinue that altogether. Pushing yourself too hard will only make your injury worse or extend your recovery time. Number 2. Ice your shin. Essentially, periodic icing over the course of 2 or 3 days may be required before the pain subsides. Plan to do it for 20 to 30 minutes, or until your leg is numb, every 3 to 4 hours. To avoid giving yourself frostbite, use a cloth as a barrier between your skin and the ice, taking special care to move the ice around so that it doesn't sit on one part of the skin for too long. And while you may be tempted to apply heat, don't. Heat doesn't actually help reduce inflammation. Number 3. Elevate your shin. While you're icing your shins or sitting for a longer period, you can also prop up your leg on a pillow or chair. It doesn't really matter if you're sitting or lying down, but I recommend that you elevate your lower leg above your heart level. Doing so, especially while you're lying down, uses gravity to help reduce swelling and inflammation. Start this elevation process in the first few days and keep doing it while you sleep for 1 or 2 nights. Number 4. Wear a compression sleeve. You can also try wearing any variety of a calf compression sleeve to help reduce inflammation around your shins and speed up recovery time. In general, sleeves can help increase oxygen and blood flow. This boost in circulation will improve your muscle endurance and efficiency. Compression sleeves also provide some pretty good pain relief, but you can pick up a pair to run in even if you don't have shin splints. Just be sure not to wrap too tightly, as doing so can cut off circulation to your tissue. If at any point you feel numbness or tingling around the wrap, loosen it. Number 5. Try anti-inflammatory medication. If you feel like resting, icing, compressing, and elevating aren't doing the trick, consider taking anti-inflammatory painkillers. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, naproxen, and aspirin will help reduce swelling and perhaps most importantly, will lessen your pain. That said, as in the case with any medication, these drugs can have side effects, such as a greater chance of bleeding and ulcers. If you are not sure how long it's healthy to take NSAIDs on a regular basis, ask your doctor or trainer. How do you prevent shin splints? All you need to do is practice these 6 proven strategies to prevent shin splints and you should have no problem regularly enjoying your favorite athletic endeavors. Number 1. Add new workouts to your routine. By strengthening your feet, calves, ankles, heels, and hips, you can lessen your chances of having to deal with shin splints. Here are a few exercises to help build that strength. Toe curls. This one's pretty low maintenance and easy to do anywhere around the house. Place one foot on a towel. Using all of the toes, even the pinky one, grab onto some of the towel and slowly pull it toward you. Then, return to your starting point. Do 10 to 15 reps on one foot and then repeat with the other. Monster walk. Grab a resistance band. Start by standing with your feet shoulder width apart and place a resistance band around your thighs or ankles. Bend at your knees at about a 120-degree angle. Keep your head and chest up, and make sure that your knees stay behind your toes. Get into a half squat stance and push your knees out as far as they will go. Step forward with the left foot, and then the right foot. Do this for about 12 times backwards and repeat 12 times forwards. Heel drop. Find some sort of step or raised surface. With this exercise, you will feel a stretch in your hips, quads, and calves. Start with a standing position with the balls of your feet on a step, your heels off the step, and your legs straight. Let your heels drop, paying attention to the movement in your ankles. Once you've reached the bottom of the position, return to the start. Complete 10 to 15 reps, and then repeat with your other leg. Single-legged bridge. You'll be on the floor for this one, so grab a mat if you have one. Lie flat on your back. Keep your feet flat on the floor, but make sure your legs stay bent. Create a bridge with your body by extending the right leg straight out so that your knees are in line. Try to hold for a minute by squeezing your glutes. Use your left hamstring to lift your hips off the floor. Do this for 10 to 15 reps. Repeat with the left leg. Work to train and strengthen your hips and core to make you a stronger runner. Point and flex. Start by standing with your hands on your hips. Shift your weight to your left leg as you lift your right leg straight out in front of you. Flex your toes towards your shin. Then, reverse and point your toes away from your shin. Once toward and once away is 1 rep. Do 10 to 15 reps and then repeat with the other leg. Toe walk. Start by standing with your feet together and both arms at your sides. Rise up onto your toes. Take a step with your right foot, landing first on your heel, then rolling onto midfoot, and finally through to the toes. Then lift back up onto your toes as you step with your left foot. Take about 10 to 15 rolling steps, then turn around and repeat back to start. Number 2, try a different pair of shoes. Depending on how frequently you run and on what surface you're running, you may need to change out your running shoes. Some runners suggest having 2 pairs of shoes and alternating wearing each pair to vary the stress on their legs. Your foot naturally collapses to help your body absorb the shock of impact. So if you're someone who overpronates, you may develop pain and discomfort over time in your ankles, Achilles tendons, outside knee, outer hip, arches, heel, and yes, even shins. To prevent injuries to these body parts, you should, at the very least, try switching to a shoe that limits pronation. This is how much the arch of your foot collapses on impact and how much your ankle rolls inward during your run. You might even consider adding an arch support to your shoe, depending on what kind of runner you are. Either way, do your research and read reviews. Runner's World's recent list of shoes for people who could use some extra support is a great place to start. Number 3, get more calcium and vitamin D. Where shin splint prevention is concerned, 2 factors are extremely important. Check your calcium levels. Because calcium plays such an important role in bone health, runners should monitor their calcium levels. If you do not have enough calcium in your system, your body will pull from your bones and make up for the loss. As a runner, this leaves you vulnerable to injuries like shin splints and stress fractures, and can even make it more difficult for your bones to heal after an injury. Monitor your vitamin D intake too. You should also check your vitamin D levels as it helps your body absorb calcium. Generally provided by sunlight, vitamin D deficiency can be caused by poor weather, sunscreen, and other factors that make it difficult for the body to absorb vitamin D. Number 4, adopt the 10% rule. Never increase your total weekly mileage by more than 10%. That means knowing how to plan your runs so you don't risk injury from pushing your body too hard or too often. Staying active and pushing yourself is excellent, but remember that sometimes it's better to run smarter than harder. Number 5, adjust your running cadence. By shortening your running stride and increasing your running cadence, you'll improve your mechanics so that you put much less force and impact on your feet, shins, and knees. First, get a baseline of what your cadence actually is. It's pretty simple. Pull out your phone and set the timer for 1 minute. Go for a run and count your steps on one foot. Then, adjust your running cadence to try to keep your foot strikes to around 85 to 90 strikes of 1 foot per minute. Number 6. Run on softer surfaces. It's no surprise that the harder the surface you run on, the stronger the force on your body. Concrete surfaces like sidewalks increase the force that your muscles and bones absorb, and over time, your muscles become fatigued and overused. To prevent shin splints, try to run on softer surfaces like grass, dirt, sand, or tracks and fields. Doing so will help soften the force and shock on your bones, tendons, joints, and muscles. So long, shin splints! Don't let the fear of shin splints keep you from going out and exploring the running world. Just make sure you stay safe and have fun. Thank you so much for watching. Please remember to like the video, leave us a comment, and subscribe to our channel for more content. This video was brought to you by Runners Athletics, makers of the best running sunglasses for men and women. UV 400 polarized, anti-fog, ultra lightweight, and equipped with spring flex hinges. These sunglasses will race past the finish line while most other sunglasses fall short. Gear up for your next adventure at runnersathletics.com.